You're the ICU doctor on call, and a 60-year-old woman is dropped off in your unit after a long cardiac surgery. She had severe multivessel disease as well as severe mitral stenosis, and so she underwent a triple bypass surgery and a mitral valve replacement. But she was so hemodynamically unstable, she got almost 20 units of blood and blood products in the OR. She was actually started on VA ECMO, cannulated to the femoral. Preoperatively, her echocardiogram showed an LV function around 60%. Intraoperatively and postoperatively, her EF went down to about 15%. She was on multiple vasopressors when she was brought to the unit. They had pushed some sedation as well. So immediately in the unit, you start her on sedation, propofol, fentanyl. You actually give her a vecuronium drip as well, mainly because she still has an open chest from this massive surgery. She's running several infusions. She's running epinephrine, norepi, vaso. She's also running dobutamine, milrinone, as well as an amiodarone infusion, as well as a heparin drip now for the ECMO, coupled with a insulin drip. Now, as soon as she's dropped into the ICU, the nurses are settling her in. And unfortunately, the ECMO starts to alarm. The beeps are continuing nonstop, and the patient's blood pressure is now starting to crash. The map is going from 60s to 50s to 40s to 30s. Right in front of you, you're ordering a bunch of albumin that the nurse is setting up immediately. But again, because there's 20 different infusions, it takes some time. You're looking at the ECMO machine, and now it's beeping that there's an air bubble in the circuit, as well as the ventricular site pressure is really negative, greater than negative 200. You look at the circuit and lo and behold, there's some air bubbles there. What is your next steps? How do you stabilize the patient and prevent them from dying?